I'm going to go ahead and start. Okay, so welcome to session 2. Last week we discussed personal protective equipment and disinfection. This week we're going to talk a bit about ventilators. We're also going to include oxygen concentrators, but there's so much content that we decided to cut it in half. So we'll do ventilators this week and we'll do oxygen concentrators next. Just so you know, this information is created by Assist. You are free to share the recordings and the slides with any engineer or technician who needs it. We're happy to invite also anyone who could use this material. For those of you who are new to Project Echo, I'm going to share a few ground rules. The foundation of our conversation today is love and respect. Please respond kindly rather than react if you disagree. It's all of our responsibility to keep Echo a safe space. Be sure to test your equipment ahead of time so the call runs smoothly. You can mute your microphone when you're not speaking. That button is in the bottom left-hand corner of your screen. You can also, when we open up for discussion, please remember to unmute yourself and also introduce yourself by name and hospital. Speak clearly, and if you're in a large room, please stay close to your microphone. And if you have any issues throughout the call, you can just send us a message through the chat here or by email at assisthtm@assistinternational.org. So we're starting with the introduction now, and we'll move on to a didactic about ventilators. We'll also talk specifically about a special case where you can use anesthesia machines as ventilators in dire circumstances, and then we'll open it up for discussion. As I mentioned, we're going to cover oxygen concentrators next week. To summarize what we discussed in session 1 about PPE and disinfection, COVID-19, the virus, can be stable on some surfaces for up to 3 days, particularly plastic and stainless steel, which is what most hospital surfaces and medical equipment are made of. So how do we keep our hospitals and equipment virus-free? We use PPEs when we're working on equipment, even as biomedical engineers and technicians. We use disposable single-use gloves, gowns, caps, shoe covers, respirators, and eye goggles. And we also remember that gloves and PPEs don't replace hand hygiene. There's a great video on that in your session 1 email. Also, when we're disinfecting equipment, both surfaces and reusable equipment, we use disinfectants listed on the right. You can find more about those at the link on this slide. So in summary, everyone should practice basic hygiene and social distancing. In hospitals, clinicians and biomedical professionals alike should use PPEs, use basic hygiene, increase the use of these things because of the viral outbreak, and also disinfect equipment more often, remembering that the virus can last up to 3 days on some surfaces. For more resources, you can go to the WHO Operational Support and Logistics Disease Commodity Packages at this link. And that will have more about specs for the equipment you should use, supplies you should have on hand, and PPEs you should be wearing. If you're a clinician, you can use the link at the bottom of the page, and it will talk a lot more about the clinical use of ventilators, which we won't be able to cover today. This is a refresher module meant for people who have either attended pre-service trainings or trained with Assist or EWH. Our goal today is to refresh the material you've already learned, such as performing preventive maintenance on ventilators, basic troubleshooting for ventilators, and proper disinfection of respiratory equipment between patients. And with that, I'm going to hand it over to Guna. You can go ahead and start.
Hi. Okay, basically when you talk about ventilator, so you are talking about a machine that support patient on breathing. So all this, so that's the purpose of ventilator. So when a person couldn't breathe properly, all this, they use ventilator as a support device to breathe. Okay. So when you talk about clinical goal, basically major goal is relieve respiratory distress, all this, and make sure the patient recover very fast and move on. Okay, that's the purpose of it. Okay, when you talk about ventilator, you need to know most of the system we are talking about gas flow, all this. So ventilator system is basically that's an inlet and outlet gas from high pressure to low flow pressure, all this. So it's talking about Y connector, single limb connection for breathing circuit, filter on the both side, inspiratory and expiratory, and humidifier, all this. And control volume for breathing and monitoring. So that's the purpose of the gas flow system, all this on the ventilator. So this is basically a block diagram structured. So it's talking about air and oxygen coming into gas mixing and go to the inspiratory valve and flow. And there's a filter in between inspiratory and expiratory. And the inspiratory wall gas will go through a humidifier and go to the patient. At the same time, in between, there will be a microprocessor for the setting of the device for inspiratory breathing, and monitoring and alarm is to monitor the patient pressure, all that on the system. And on the expiratory side, you got a valve and a filter as well. That will be going out to the atmosphere. So the filter play a very important role during this type of process because you don't want any cross infection on the device as well. So filter are very important. So this is the block diagram that you need to know. So this is the system structure. You're talking about what's you need to know that what I explained earlier, gas mixing, inspiratory valve, flow, all this. And the sensor on the expiratory valve and inspiratory valve play a very important role. Then patient delivery circuit, microprocessor with the monitoring alarm system. So when you talk about ICU ventilator, you're talking about number one, support arm, number two, inspiratory port with the filter, then number three, active humidifier, number four is inspiratory line with the water trap, and YPs, some they use TPs type, expiratory line with water trap on number 6 as well. Flexible connector, then flow pressure sensor, nebulizer, all these are normally you're going to see in the ICU ventilator. Okay, the following one is a patient breathing circuit. These are commonly you're going to see in the anesthesia machine, but the practice is almost similar, but only different is you got absorber, all that, and these are closed loop circuit. So closed loop circuit is basically you breathe in and breathe out. Is going to go around again with some fresh gas, all that. So this is how the system works. Okay, delivery system. So that's two type of delivery system. Normally they use non-invasive and invasive type of connection. Okay, for the breathing. So ventilator normally often used for short period during surgery or general anesthesia. Normally even in the OR with the anesthesia machine, you got a ventilator as well. So and for COVID-19, currently you need to use ventilator as well because it's a lung disease thing in ICU. So it's almost a very important device to support breathing of the patient. Okay. So when you talk about operating procedure, so you need to check daily check purpose. Basically, you want to check first is unit ready to use or not. Next, make sure the setting, alarm level is correct, appropriate. for the patient condition, all that. That's normally done by the clinician. Then after connection to the patient, to the ventilator, they always must check, evaluate the patient, all that. And every single mechanical ventilator used in ICU, they got different type of moods that you need to know on a certain extent for you to check in future. So normally what you're going to see on the ventilator control is tidal volume, PO, and patient breathing and PEEP, all this, and trigger time, IE ratio, and you're going to see a display of screen that showing the output of the ventilator. Okay, type of ventilator mode. There's so many types of ventilator mode, depends on the range of your product. From low range, from the top range, they got so many functions. Some of it, they got more than 5, 6 functions. Some they got only 4. It's good enough to run a ventilator. So this is type of moods that you're going to see in the mechanical ventilator. So the common ventilator mode that you're going to see is like CMV, SIMV, CPAP, ACMV. All these are type of control, depends on ventilation. Some are using pressure, some are assist control. So these are short terms that you use that you're going to see on the ventilator. These are moods that commonly you're going to see. So example of ventilator moods, that's I specification moods like SIMV, PSV is volume control and pressure support. So basically it support itself. So these are type of high range of moods control. So breathing type. So when you talk about non-invasive, you're going to see most of it volume control and pressure control depends on the setting. So non-vent masks are used with the HME filters, all this. Tidal volume. So these are specification that normally you're going to see on the tidal volume. Some start from 10 to up to 1005. New models nowadays got up to 2000 milliliter as well, the tidal volume. Driving mechanism for ICU ventilator is basically you're going to see most of it using a piston type. So this is very common that you see a cylinder mechanism is used to give a volume and the pressure, all that. So when you talk about circuit, HME and HEPA filter play a very important role on the WISE type of circuit in the ventilator. So basically you're going to see HME is heat and moisture exchange, and HEPA filter is used on the exhalation point to breathe out, so to make sure no cross infection on the ventilator. This is type of HME and HEPA filter that you're going to see normally. And this play a very important role during COVID, even a normal condition, because you don't want any cross infection during using a ventilator. When you exchange patient, you don't want any cross infection between the patient. So this is some additional COVID airway management thoughts. A very important thing is you need to know, you need to use filters on your Y circuit or inspiratory line and expiratory line. So to make sure the reason you use filters is because some of it, you have to remember when you talk about ICU ventilator, the exhalation point is going to be airborne. It's going to go through atmosphere. So we need to filter all that before it throw out to the atmosphere on the air. So very important when you use ambu bag, you need to filter as well. All this to make sure it doesn't expose to the airborne situation or anything. So this is specification of a ICU ventilator. Always remember you need to know about tidal volume, the pressure on inspiratory, volume inspiratory of the line, respiratory rate is very important, CPAP, PEEP is very important as well. So this specification is very important, and key modes of ventilator. Earlier I did explain about volume control, modes, all this. I did explain type of modes that you're going to see. So it's very important when you get a ICU ventilator, you need to have this type of modes. So alarm is very important. I did mention when you talk about all this ventilator, you got low alarm, high respiratory alarm, all that. Very important. Battery alarm, gas flow disconnection alarm, all this. It's very important actually. And the pressure line should be 35 to 65 PSI, all that. Okay, preventive maintenance. This is very important part of it. Currently, you got quite a lot of ventilators used in the hospital, but you need to maintain, make sure it perform during this period and work properly. So the interval maintenance, normally you need to know is the type, patient breathing circuit, all these need to be looked after properly, and make sure it works properly. And if single use, make sure you clear them. Okay, and you have to monitor the water trap. Very important, because you don't want the water trap create some issues with too much of water, all that. So this is daily routine that you have to do. Inspect the bacteria filter. Bacteria filter need to be disposed. Breathing circuit, water trap, some of it disposed, some need to be cleaned and used back. So patient breathing circuit, it depends. Some of it can be a single use, some of it multiple use that need to be autoclave. So all these need to be carefully checked. So when you talk about cleaning, and on your breathing circuit, so this is steps that you're going to use on autoclave. So the temperature and the time that you need to autoclave. Remember, most of the time when you want to autoclave your breathing circuit, clean it before you autoclave them. So when you come to maintenance procedure, so this is basically you're talking about how to clean reusable patient circuit. It's very important. So make sure it clean. Some of it can use up to 25 cycle. Then you need to replace some of it. A long run of use depends on the type of breathing circuit that you get. So you need to wash the breathing circuit, remove all that. Then you need to sterilize all this. So this is maintenance procedure for breathing circuit. So for preventive maintenance, again, why you need to do preventive maintenance? Always you have to remember, you want to reduce the risk of injury to the patient, staff, visitor, and the biomedical engineer itself. When you working with the machine, all this, you have to be careful. So it's a very important is to take care of the equipment and to make sure decrease the cost of the equipment maintenance, to avoid operational difficulty. So basically, if you don't maintain, your oxygen sensor is not working properly, all that. So there will be a difficulty of running the machines. So during the procedure, maybe the user have difficulty to run the machine. So always make sure you maintain, you calibrate all these important things. And maybe your hospital got certain standard of codes they are following. So you need to fulfill this particular code, standard, and regulation. So when you talk about PPM procedure, you're talking about visible tests. Basically, you're going to check the physical of the equipment, then documentation, all that. Electrical safety and quantitative tasks is basically you checking the performance of the device, whether it's working up to the right performance level. Test tool that you need, normally you need an electrical safety analyzer, ventilator analyzer, test lung, and multimeter. These are test tools that always you need to do your safety tests, all this. Oxygen sensor. Always remember, oxygen sensor play a very important role in your ICU ventilator. So always make sure it calibrated and work properly. If you're still not happy with the results, try to verify it with another oxygen analyzer device or with your ventilator analyzer that they have an oxygen sensor together. So you can verify the reading, but try to calibrate first. If the calibration pass, that means the sensor is still good. Because always remember the oxygen sensor, they got a lifespan, maybe 18 months, sometimes 2 years, depend on the usage, but that's the maximum. Some of it, 18 months, you need to replace because the performance change. Flow sensor, always another important part of component in your ventilator. So basically, you need to calibrate them as well to check, to make sure the flow is working properly. You can compare the results with the ventilator analyzer. So you calibrate, check whether the flow circuit is clean, and if got moisture, you need to clean the moisture. Be careful, because sometimes too much of moist, the flow sensor going to fail. So when you talk about configuration of a sensor, normally you're going to see inspiratory flow sensor and expiratory. Some of it you're going to get a proximal flow sensor, depends on the setting of the user and depends how they're going to work it out. So the proximal flow sensor is basically is going to capture the reading of inspiratory and expiratory combination together to monitor the total output and input. So these are some additional function on your ICU ventilator. But inspiratory flow and expiratory flow sensor is very common that you're going to see some of your ICU ventilator. Some only you got inspiratory flow, but you don't have expiratory flow sensor, but you got expiratory pressure sensor. So this is the common sensor that you're going to see on the ventilator. Sometimes you're not going to see proximal flow sensor at all, but you're going to see commonly expiratory flow and inspiratory with the humidifier connected. This is Y connection type of patient circuit. So this is another method that you're going to see. So sensor replacement. When you talk about sensor replacement, this is common thing that you're going to do. If the sensor is failed, you're not going to see any flow reading on your ventilator screen. You need to replace. You try to calibrate first. If not working, you need to replace the flow sensor and make sure calibrate after that. Test lung. Okay, when you talk about test lung is one of the important device that you use to check your ventilator is working or not. So normally, one of the best thing is to do is test them by using test lung before you use it on the patient. That's what clinical people do that. In hospital, when you go to the department, you're going to see they're going to test with the test lung. If the ventilator is working properly, then only they're going to use it on the patient. So this is to prepare the ventilator unit on the patient. Electrical safety is very important because you need to check the equipment is safe to use on the patient. So you need to check, is it electrically, the equipment is safe, all that. So you need to do electrical tests during the PM. So when you talk about report, you need to, normally you have to, depends on the class of device, you got class 1 device, class 2, but most of the ventilator or anesthesia machine that you see is class 1 device. So you need to do all these tests, except patient apply circuit. So for ventilator testing, you need to monitor tidal volume, breathing rate. So you need to set, for example, 300, and you need to see the output reading on the tidal volume, breath rate, PEEP, O2. Another one is IE ratio. This is very important parameter that you're going to test. Sample of second checklist is almost similar, but only thing you're going to do some calibration on O2. Then you got IE ratio, an alarm test. You're going to test with the test lung, all that. Ventilator connection for full test. So you got control module, HEPA filter. Remember, you have to use HEPA filter during the test. You don't want to cross-infect your test tube. Very important. High flow module, an oxygen sensor to monitor the oxygen. High flow module to monitor PEEP, tidal volume, your breath rate, all this. So this is bi-direction connection, sample of connection that you going to do during your ventilator test. So when doing a full ventilator test, this is how the connection look like. Remember, HEPA filter should be on the end of Y connector. You don't want any cross infection to your test tube. And you got test lung and your monitoring module. So this is how the test results look like. You can see your tidal volume. You can compare the results VTI, VTE, and you can compare the breathing 12, and you got same reading line. So the breath rate is 15. Here is FR, the breathing line is 14.6. So it's almost the same reading. So this is how you compare your reading and write on your checklist. So troubleshooting. When you talk about troubleshooting, there's a lot of things that you need to look into it. So always make sure the water trap is clean, all that, replace them. Then the oxygen sensor, alarm, you need to calibrate the sensor, replace the oxygen sensor, make sure all this work. Then backup battery, check the battery, discharge and charge. If still not working, you need to replace the battery. Then high and low airway pressure alarm, make sure your gas supply is properly connected with the right pressure. Then your mode of setting of your system can cause a lot of alarm. So internal shutdown alarm is basically can cause because of internal memory battery is low. So eventually what happens is your screen become blank, all this. Then continue working with alarm, check your parameter setting or circuit leakage. Basically check, try to do self-calibration, see if there any fail, try to troubleshoot that particular, narrow down your problem, try to check on that particular point. Maybe it can cause because of your flow sensor or pressure sensor or your circuit broken or something like that, your breathing circuit. Then overheat. Overheat, normally what happens is the ventilator fan is not working properly or the system is not been cleaned. So you get overheating indication because of this type of problem. So sometimes your filter on your fan is not clean. So you got heat circulation in that inside the circuit. Then safe valve, pop off, open, whistle, all this can cause because of high pressure, wrong regulator use, line connection block, all this. Wrong regulator use is very common because you're going to use a wrong type of regulator in the hospital. That can cause a lot of problem actually. CO2 alarm, that's maybe exhalation valve assembly or the sensor is not working properly. Then gas flows sensor alarm, check the flow sensor and oxygen sensor, try to perform calibration. That can solve the problem. If not going to solve the problem, check the sensor if the sensor is working properly or not. So this is very important when you do a troubleshooting. And another best method is every ventilator brand, they got their own error code. So better look into the error code and refer back to the user manual. Or if you got service manual, refer back to the service manual. This is another fast way to do the checking. But this is what the common error you're going to find and how to fix it. So when you talk about ventilator, the summary between patient, one must be sterilized breathing circuit. So when you change patient, you need to have a new circuit or new sterilized circuit. Empty and sterilized replacement, the water trap, all that. Recalibrate oxygen sensor, flow sensor. Change expiratory filter and wipe down machine front to back, included screen, sensor, cables, and touch point. So this is very important when you look into ventilator device.
All right, I think we're going to move straight on to our case study. Just want to say thank you to our assist team for putting this together. Benjamin is not joining us, so if you can talk a little bit about the special case of transitioning anesthesia machines used as ventilators, you can go ahead.
Yep. Okay. This is another way of to get extra ventilator. Basically, what happened is when COVID, probably the ventilator is overwhelmed in your ICU department, all that, and you need another ventilator to use. So this is another way of doing it. Your anesthesia machine, you can convert as a ventilator. So basically, is to run short period of time, all that. You can use them as a ventilator. Okay. So, but you need to understand when you use anesthesia machine as a ventilator, you need to make sure that you got HME filter, all this, because anesthesia machine is basically, they don't have a humidifier because they are closed loop circuit, all that. So you need to look into that particular part of it. So anesthesia ventilator is basically can use a rebreathing, exhale gas. Avoid using on COVID patient, but you can use on the normal patient as long as you confirm the patient is normal. So no problem. So humidity circuit and clogging filter and frequently change CO2 absorber. This is very important. You need to check all this every time and practice in the good way. And most of it you can use non-critical patients. So they still need a breathing support, but not that so complicated. So how you do it? Remove the vaporizer. You're not going to use a vaporizer. Convert the driving gas oxygen to air. So basically you can combine oxygen and air. Refer to your technical reference on the manual. So make sure that you're using HME filter and tube connection. Attach a second HME filter or HEPA filter and replace filter every 4 hours. Depends on the condition. And ensure 3-liter reservoir bag is connected. Set the alarm volume to maximum. Check the alarm limit, CO2 setting, all this. Keep the CO2 absorbent in place. So set the fresh gas somewhere 6 to 8 liter for adult patient. So always flush the machine, remove the anesthesia agent, set the APL valve at 0 because you want to make sure the circuit is breathing according to that particular range. So this is another important thing. Make sure no leak on the circuit. Monitor the humid in the circuit every hour so you can check the water trap, all that. The breathing hose, replace the filter and increase the gas flow can help. Check CO2 absorbent every 2 hours or every hour, and you need to replace. Dispose the filter and dispose circuit after each patient. Clean the machine after each patient. Disinfect the machine basically.
All right, so we went through a lot of information very quickly, so we'd like to open up the floor for questions. Krishna, I know you don't have access to your microphone, so if you want to use Telegram or WhatsApp, feel free. Maybe I'll start out with one. When we discussed this previously, it was important to have an anesthesia user present, correct? If you were
Yep.
to use an anesthesia machine as a ventilator?
Yes.
What about that and why it's so important?
Yeah, but because the setting on the circuit might change a bit, so they are the best person to refer to actually.
Oh, and it looks like there's actually a few in the chat that I did not see. As far as disinfectants for patients go, I think we recommend an alcohol-based
Yep.
sanitizer, correct?
Yep.
I did ask if there were names for that, but it's just the ingredient, correct? It's just the alcohol?
Just a combination of alcohol, yeah.
Okay, I think that's just about it. Guna, is there any questions from the other session that you'd like to bring up? I know you wrote out answers for several of them.
Yeah, a lot of people are talking about a single ventilator to use on multiple patients. So that, I think clinically is not proven yet. So be careful what we are working on that. So far there's no proof, and try to avoid that particular discussion and using on the patient.
That's a really good one.
And very important, there's some incident happened that because of not using HEPA filter on the expiratory line, so it can be airborne. Be careful with that. You don't want a BMAT get infected because of this or the user get infected or some visitor get infected.
Yeah.
So make sure HEPA filter on the circuit.
Good. Perhaps one last question. I know some HMEF filters and expiratory filters are actually built for multiple uses.
Yes, yes, that's true. But for current situation for COVID, it's better to change for every single patient rather than use multiply, because sometimes maybe you think the filter is not for COVID, you ended up using for other patient, and it's going to be a cross infection. So the best thing is change the basically dispose that particular filters.
Good. Awesome. Okay. I think that's
Right.
it for today. Thank you so much for joining. We'll probably adjust the time in future meetings so that more people can attend, but overall, this has been really great. Thank you so much.
You guys.
Hey, Aaron.
Yeah,
May I have a suggestion that